How to keep your hearing safe. Most of us are interested to know how to keep our hearing safe because we hear of so many incidents of people with hearing loss and we want to keep our ears and our hearing safe. So the first and foremost is stay away from loud sound. Do not listen to headphones and earplugs with loud music. Stay away from very loud music. Stay away from big speakers and as far away as possible because a loud noise will definitely cause a damage to your hearing and you may have a problem with tinnitus as well as hearing loss on exposure to loud sound. Number two is if you are working in an industry where there is loud sound, especially if you work in pubs, if you're a musician, if you're a traffic person where there is exposure to loud sounds of traffic, my advice to them is to put ear defenders or noise cancellation devices. There are commercially available online as well as physically available in stores and they have a decibel quality to it. So you can ask for 30 decibel, 40 decibel sound reduction and these are useful for you to use. In my experience from the armed forces, I have seen most of our young soldiers and officers sometimes hesitate to use ear defenders when they are exposed to loud gunfire, mortar shelling, grenade firing, armored core people. And sometimes they suffer from early onset hearing loss because they forgot or were careless enough not to wear ear defenders or noise defenders. And it is important for persons who are exposed to loud sound in their environment to make sure that they keep their hearing safe by using noise defenders. Third is wax removal. Wax is a common accumulation in the ear canal and can definitely cause and lead to some amount of hearing loss and you must be careful about that. If you have a tendency for wax formation, have it removed periodically from your nearest ENT specialist. My advice would be to put some wax softening drops before you go so that your specialist finds it easier to take out the wax since it has become softer. For wax softening, it is easy for you to go to your nearest chemist. These are OTC or over-the-counter available ear drops for softening of the wax. If you are a smoker, please give up smoking. Nicotine is directly ototoxic. It causes toxicity in your ears. And you must give up nicotine. Not only can it cause hearing loss, but it can also aggravate your tinnitus. So if you have hearing loss or tinnitus, you must give up smoking. There are some drugs, especially some antibiotics and some other medication, which can cause you to lose your hearing or your hearing to become weaker. Apart from antibiotics, some chemotherapeutic agents, some diuretic and other medication can make your hearing go weak. So discuss with your doctor the harmful effect of the medicines that you're taking. Particularly aminoglycoside antibiotics are known to cause some kind of hearing loss. One thing that we are not aware of and which can definitely preserve your hearing is vaccination. Vaccinations are a good way to preserve your hearing, particularly measles and mumps, which are childhood and nowadays even adult infections can impair your hearing because these viruses enter your ear and cause damage. So make sure you are vaccinated against measles and mumps. Even shingles, a dangerous variant of shingles, can cause herpes zoster oticus, in which you can lose your hearing. So shingles vaccination against common viral infections will make sure that your ear remains safe. In spite of all this, if you continue to have a hearing loss, if you switch on your TV volume too loud, if you ask the people to repeat themselves, if you are missing out on sounds like the ringing of the bell or the ringing of your phone while others around you are hearing it, then it is possible you may have an early onset hearing loss. And the first and foremost thing for you to do is to have your ears checked out. And a simple audiometry test will determine the nature and extent of your hearing loss. And your doctor will then advise you about the necessary medication, treatment, or if required, the usage of a device to make your hearing better.
From diagnosis to treatment, complete ENT care under one roof at MedFirst ENT Centre. Book now your appointment.